Hemophilia is a disorder that causes the blood to clot slowly or dysfunctionally. There are a few types of hemophilia, but today we are going to be talking about hemophilia A, often called classic hemophilia. This disorder is caused by mutations that occur in the F8 gene, which is responsible for the synthesis of the factor VIII protein. This protein is responsible for coagulation and works with other proteins in the blood to ensure that coagulation occurs properly. When this gene is affected, a person may have anything from mild to severe forms of hemophilia, depending on how much factor VIII they are able to produce. The mutation of the gene can cause the protein to be semi-functional or completely missing, depending on the severity. Any mild injury, such as a paper cut or a scrape of the knee, can pose a serious danger for an individual with severe hemophilia. Even scarier, in some cases, an individual can experience what is known as spontaneous bleeding, and bleed internally from no injury at all. This is very dangerous for people with hemophilia.
Hemophilia A is an inherited X-linked recessive trait. The genes associated with hemophilia A are located on the X chromosome, which is one of the two sex chromosomes. Males have XY set of sex chromosomes, while females have two X's. This means that for females to have hemophilia A, both sex chromosomes must have the trait. In contrast, men only need one sex chromosome to have the gene to be hemophilic. In addition, females can be carriers of hemophilia when one of her X's has the trait, while the other does not. For example, if a father has hemophilia and the mother does not and is not a carrier, there is a 0% chance their son will be born with hemophilia because he needs to get an X chromosome from his mother, who does not have hemophilia. A daughter from this couple will be a carrier of hemophilia because she must get an X chromosome from her father, who is hemophilic, and the other X from her unaffected mother.
Hemophilia treatment is divided into two categories: episodic care, which is used for emergency, and prophylactic care, which is used for prevention. Factor replacement is used in both types of care. This is where patients receive an infusion of the missing blood clot factor, so the person's blood is able to clot properly. There are currently two main clotting factors available: plasma-derived factor concentrates and recombinant factor concentrates. Recombinant factor concentrates do not include human plasma and are made by using technology to genetically engineer DNA. Recombinant factor concentrates eliminates the possibility of blood-borne viruses from spreading. For episodic care, infusions are given to the patients immediately to clot the bleeding. For very severe cases, patients are given infusions 2 to 3 times a day for 10 to 14 days. For preventive care or prophylactic care, infusions are given once or twice a week to prevent any bleeds from occurring. Although infusions are the most typical care, medications can also be given to help prevent bleeding. While hemophilia can be a serious life-threatening disease, with proper preventive care and being cautious of their actions, those who are affected can still live happy and healthy lives.